Sunshine, gonna make your day. Sunshine, gonna make your day. Sunshine, gonna make your day.
Hey everybody, welcome to the Real Nurses Talk Show. I am your host, Sonia Justice. She's going to be talking to us about the new changes that affect you in terms of primary care, in terms of the benefits they're going to be getting.
Gonna make your day. Sunshine, gonna make your day. Sunshine, gonna make your day. Looks like everything's good in my ends, 'cause I just
Welcome back. Thank you for being here. Today we're going to be talking about Obamacare. It is the law of the land. A lot of people, there is so much misconception about this law because it's been politicized so much. So we're going to do our very best to help you understand how it's going to benefit you. We came out to the streets and talked to you, and you were able to voice your concerns and your anxieties about this new law. So we're going to go ahead and share with everybody else what your comments were, what your suggestions have been.
sunshine, sunshine. Sunshine, gonna make your day. Sunshine, gonna make your day.
Patty Kirby.
And Patty, where do you work?
I work for an Avamere skilled rehab facility in Lake Oswego.
And Patty is the first nurse that we're getting on camera.
Hi, that's special. Thank you.
That is very special. So Patty, you heard us talking before about the healthcare law. How do you think it's going to impact you or your patients? So,
As far as me and my family, I'm just concerned about the healthcare costs that will raise and what that means to me as a single mom and a provider of health insurance for my children. But I am for it. I think everyone should be able to have insurance, and that we need to take responsibility to help each other in our community and our nation. And I think it's a good thing overall, so we'll have to see what happens.
okay, so I am going to go back to you being a single mom. So your concern is the cost of healthcare.
Yeah.
So, right, are you worried that it may be higher with the new law? Or
Yes, definitely. Yeah. I mean, any cost increase will definitely affect me, and my month and every month. And so, yeah, it's a concern for sure.
do you think it's going to affect you personally?
I think overall, prices are going to raise, and I think, premiums are going to raise. So that's going to cause us to pay more for private healthcare. And so if we don't want Obamacare, but
A little bit about the format of our show. The Real Nurses Talk Show is a first of its kind on television. As a nurse, I am going to be your host. Every single one of our guest experts that are going to be passing through this show in studio with me are all going to be nurses. Isn't that great? I'm really excited. I hope you're all very excited. We have a powerful show for you today, and let's get started. Hi, everybody. Welcome back. Thank you for being here. We have with us today a truly wonderful guest, and it's my honor to introduce Susan King to you. Hi, Susan.
Hello, Sonia. Thank you.
I ask you, what is ONA? What's Oregon Nurses Association? What does it do?
The Oregon Nurses Association is the professional association and labor union for registered nurses in the state of Oregon.
Mm-hmm.
We were founded in 1904, so we're pretty old. We've been doing this a while. And our purpose is to represent the profession of nursing and advocate for quality health care.
Awesome.
Obviously, appropriate topic today.
Very much so. And you are the executive director.
I'm the executive director, yes.
What does it entail being an executive director of such an organization?
I report to a board of directors, all of
Okay.
whom are nurses, And my responsibility is to carry out the goals and directives from our 12,000 nurses across the state.
Oh my.
And I get to do very fun things, such as lobbying for the Affordable Care Act in Washington and in Salem.
That's fun. This topic is Obamacare. There's a push towards, like we mentioned before, more preventative approach to healthcare. So can you please tell our viewers what kind of changes to expect with regard to their primary care?
Well, the intent of the Affordable Care Act and the work that's being done here in Oregon is really to help individuals and their families stay well, get well, or manage chronic illnesses successfully. And to do that, we in Oregon and through the Affordable Care Act have placed a great deal of emphasis on what we're calling the primary care home.
Okay. What's that?
What is a primary care home? Good question. A primary care home is a group of professionals or an individual professional. So in some cases it might be a nurse practitioner out in Enterprise, Oregon, who has her own clinic. Or in some cases it might be a group of professionals, a nurse practitioner, a physician, nurses, mental health specialists, pharmacists, who are, their practice is really designed to interact with individuals and their families over time and build a relationship that involves keeping them healthy or helping them stay healthy.
Interesting. And that doesn't exist right now, correct?
Well, we've had primary care for a long time. And actually, I like to think about when I was growing up here in Portland, my family had a family physician, and my family's physician employed a nurse named Shirley, and actually she ran the place.
Oh, nice.
She did everything. She made home visits, she taught, she gave us advice, and so I really think that our primary care home is just the newest version of what I lived with when I was growing up in the 50s.
Got it, got it. It is wonderful that there is more of a push towards preventative medicine.
Yes.
And it's really great that nurse practitioners are going to be in the forefront of this. Really excited about that. Some of the essential benefits of this new law have become very politicized. Can you shed some light on that for us?
Well, I think probably the issue of essential benefits has been misrepresented or is unclear in the minds of the public, and certainly since you've been out interviewing, I'm sure you're hearing that.
Right.
The 10 essential benefits under the Affordable Care Act, again, are aimed at helping people stay healthy. So there's a great emphasis on no cost payment, no first dollar coverage is what they call it, for the U.S. Preventive Health Services interventions, such as, pap smears, mammograms, those kinds of things. And so the essential benefits really are an attempt for us to say any plan that is offered in this country will have to be built around the things that we know make a difference in people's health.
Got it, got it. That's pretty awesome. Are there any parts of this law that you think would directly affect, the Americans who are in the workforce?
Yes, I think there are two ways that the Affordable Care Act will affect the workforce. First and foremost, there are a number of provisions within the Act that actually provide incentives, mostly in the form of money, for individuals, nurses, nurse practitioners, physicians, again, to go into primary care, often in underserved areas or with people who haven't traditionally had access to health care. And so there are a number of workforce provisions in the Act. Secondarily, we all know people who stay in jobs because that's where they get their health insurance. And if they're unhappy, they're afraid to leave because they would no longer have health insurance. And in some cases, once they leave a group plan, they wouldn't qualify as an individual because they had even a minor pre-existing condition. So I think two big immediate changes are the assistance that the Act will give to incent the kind of care we want, and secondarily so that people have options to get health insurance.
Oh, that's really, truly wonderful. And we mentioned before that nurse practitioners are going to be in the forefront of this with the primary care and everything. Can you explain to them, do nurse practitioners work for physicians here in the state of Oregon? Are they assistants to doctors here?
They are not. Nurse practitioners in Oregon have a very long history of independent practice. And I'm very proud because the Oregon Nurses Association has lobbied successfully over the years, beginning in the middle 1970s, to establish nurse practitioners as primary care and specialty providers. They are independent. They prescribe medications. They consult with their physician colleagues, just like physicians do.
Very nice.
And they're a growing part of our workforce.
That's really great. And a lot more insurance companies are providing compensation, I hope.
That's correct, yes.
Yeah. Very, very nice. Well, that's all the questions we had for you today.
Well, I've enjoyed talking with you. And
It's been great.
It's going to be great to see the act roll out.
Oh, thank you.
Yeah,
I truly
and thanks for your
appreciate the
work.
support.
Thank you for
from
inviting me,
Renee.
Sonia. I appreciate it.
Thank you.
Nice to see you.
Nice to see you. Troy is going to be telling us what he thinks of Obamacare.
Yeah, I think it's going to be great for me personally because I'm a student and I have no health care right now. And so whenever I get sick right now, it's just sort of muscle through it. I just don't know how much it's going to cost me. So that's the big thing, is how much is it going to cost me for the rest of my life. The nice thing right now is school's got health care for me, but once I'm out of school, I'm sort of on my own. And it'd be nice to have a universal health care. I'm from Canada originally, and they have universal health care, so anytime I go up there, I can get something fixed. But here, it's a little bit difficult. You just sort of have to go day by day and see what happens, and it's a little bit curious, sort of like it's not as safe as you would think for America. You think America is one of the greatest nations around, and we don't have something to take care of people who are just, you know, fighting common cold. They could use some antibiotics or something like that. So it will be a step forward, I think, for all of us if we can take care of a need such as, you know, a basic need of being healthy. I think our nation will grow as a whole if we take care of that thing, and then we can focus on other problems. And I mean, it might cost us a little out of pocket at first, but once everyone gets aboard on it, it will be helpful to all of us who are in need of it, you know?
Sunshine, gonna make your day. 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 Sunshine, gonna make your day.
There's a new healthcare law in town, and you're very much aware of this. It's called?
Obamacare.
How do you think it's going to affect you? You can take the mic.
Thanks. I do. Well, I don't know. I'm not going to predict it. I know it will impact me, obviously. I think it's going to impact everybody. I do my best to be on the preventive and proactive side of healthcare. Luckily, I don't have to go see my doctor. I eat a super clean diet. I lead a very healthy lifestyle. So when I go see my doctor, he usually says, "What are you doing in my office? Leave, get out of here." But I think it's going to impact people's lives in different ways. I'm going to continue to stay on the proactive and preventive side of things, so I'm hoping that it's not going to really have a significant change in my lifestyle, but I don't know. We'll see. I'm hopeful, I'm positive, I'm optimistic about it.
Okay. So are you self-insured then?
I am, yes.
Okay.
I'm an independent contractor as a sponsored athlete, so I'm self-insured. So
Sunshine.